So there, I also have here the lubricating jelly. This is used to lubricate or make it makes the urinary catheter tip slimy para mas madali siyang pumasok sa urethra ng ating pasyente. Okay, so I will sanitize my hands. I have read the doctor's order. I will sanitize my hands. I will go to the patient. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3. Okay, good morning, Ma'am Smith. I am Grace. I am your caregiver for today, and I was tasked to insert your catheter. Now, before we proceed with the procedure, ma'am, can you state your name and your address to verify that you are my patient? Smith, blah, blah, blah. Sabi niya. So, siya si Mrs. Smith. Thank you for the information, ma'am. So, now, I am going to insert the catheter, and while doing the catheterization, I will be touching your perineal area in some parts of your body. Will that be okay with you, ma'am? Yes, okay. So, are you okay if we start the procedure now, or would you prefer to do, would you prefer to do something else before we proceed with the procedure? No, okay na daw ngayon. Okay, so thank you for allowing me to do that. I will exit your room, prepare my equipments, bring it in your room, and we will begin with the procedure. Okay, I will go out, I will wash my hands, and prepare the procedure. Naka-cart kang papasok or nakalagay siya sa tray. Okay, and then ilalagay mo sa table ng patient. So, good morning, ma'am. I am back. I'm Grace, your caregiver again, and I am back. And are you ready to proceed with the catheterization? Yes. Okay. So there you go. Thank you for allowing me. I am now going to untap the linens. Okay. Now that I untap the linens, I will, itataas ko yung linen ni ma'am papunta sa taas para hindi siya lamigin kahit na siya ay mag-dorsal recumbent position. Okay? Yan. Hanggang makita yung sa may perineal area. Alright? So, there you go. Kung nakapanty si ma'am, tanggalin natin ang panty ni ma'am. Alright? So, there you go. I will first get my underpad. Pahaba po siyang ilalagay. Okay? Unlike sa bed making na horizontal. Okay, so ma'am, we are going to insert your catheter. So I will put your leg in the dorsal recumbent position. And at the count of 3, please help me to raise your sacral area or your buttocks. 1, 2, 3. Okay. Another one, ma'am, please help me. 1, 2, 3. Thank you for the assistance. O, sino ang paa ni Mrs. Smith dyan? Thank you. Next, I am going to put my drape. Yung drape, kaya ko nilagay dyan kasi that's a sterile one. Okay, and sterile yan, hindi yan basta-bastang tinatouch. Okay, usually sa hospital, that's color white or color green. Naka-cover data white cloth. So, open it. Yan. So, wrong side out siya. And then, itaas mo. Doon ka lang sa gilid, naghahawak. Okay? Sa gilid kasi hindi ka pa naka-sterile gloves. And this is sterile. Okay? Afterwards, ilagay natin siya doon sa may perineal area ni ma'am. Okay? As much as possible, dito lang kayo sa loob, humawak. Okay? Doon tayo sa sides. That is to provide a degree of privacy. Hindi mo naman kailangang tingnan ng puwet niya kung ikaw ay magka-catheterization. After that, nalagay ko na, I will prepare my equipments. Okay? So, ada tiyag serve. Sino tiyag serve? Sino ti circulating nurse ko? O sikan? Pag magbubukas ka, ma'am, pag magsiserve ka, just open it and do not touch anything inside. Okay? Okay, so there. I will now start with my sterile procedure. Since okay na si ma'am, check nyo pag kailangan mag-perineal area, ay mag-perineal care. Okay. Open it. Yung mga nasa gilid, yun yung dapat ninyong hawakan if you're going to open. Skin to skin, gloves to gloves. Thumbs away. Oh, kita. Doon lang kayo sa loob humawak. Okay. Fix it. Hold the middle of this. Sa loob lang din kayo humawak. Siya ang gagawin kong sterile field kasama ni fenestrated drape. Now, dahil siya ay sterile na, ma'am, paserve ako. Paserve ako ng urine bag. Kunwari naka-cellophane data. Thank you, Pai. Okay? Ang hahawakan nyo lang yung tube. Yan. Make sure na yung tube nasa sterile area. Alright? Next, urinary catheter. Okay? Doon lang din siya sa sterile area. Ma'am, next. Yes. Okay, get it. Check mo yung parts. Sige ma'am, pakitaas ito, yung bote, and I will do not touch my syringe. Sige ma'am, baliktad doon.
Itaob mo.
Itaob mo para, ay, sorry ma'am. Itaob mo para, sige ma'am, itaob mo para makapakuha ako ng water. Okay, so I will use 2.5 since yun ang advisable para sa aking urinary catheter. Okay, thank you ma'am. Kapag nagtutusok kayo, you can leave it there and then do the fishing. Okay? And then, okay na. Mag-prepare ka na lang dito ng pagtitake natin mamaya ma'am. Tatlong short lang. Okay? Then, I will get my kidney basin. Usually, naka-cover yan para malinis siya. And then, I will get my forceps. Okay? So, I will now, sterile na ako, di ba? I will now start with the procedure. Okay? So, I will get 1 cotton balls with betadine and I will wipe. Laging nakataas yung kamay ninyo. Huwag niyong igaganon kapag naka-sterile na kayo. I will wipe from mons pubis down to the labia majora, down to the sacrum, discard. Next, mons pubis, down to labia majora, down to the sacrum, discard. Then, mons pubis, down to labia minora, down to the perineum muscle, down to the sacrum, discard. Huwag puro inos ta hemorrhoid pasyentiyo. Then, from mons pubis, down to labia minora, down to the perineum muscle, down to the sacrum, discard. Then last, then last, from mons pubis to the clitoris, to the urethra, to the vagina, to the perineum muscle, to the anus, discard. Okay? So, since I am done with that one, pwede ko na siyang tanggalin from that area. Okay? Next, I am going to assemble now my equipment or my materials. Yung softer part ng inyong catheter, doon nyo ilalagay yung ating urine bag. Okay? Open it. Then, humawak lang kayo doon sa colored part. Okay? Pakiramdamang mabuti. Right. So, there you go. I am now ready to insert. Ma'am, palagyan naman ako ng lubricating jelly. Itutut mo lang, ma'am. Do not touch. Do not let the bottle touch my sterile gloves. Okay? So there, i-roll ninyo yung catheter para medyo tumayo. Now, you're going to lubricate at least 2 inches, no? Para hindi masyadong masakit para sa patient. Next, you're going to touch and spread. Lola or ma'am, I'm going to touch your perineal area and I will spread your labia majora para maipakita niya lahat ng nasa loob. Okay? So, tignan mo kung nakita mo. Okay? Pag nakita mo na ready ka na may place na to insert, then you say, Lola, at the count of 3, I will insert the catheter. Please inhale and hold your breath for your vaginal muscles to relax. 1, 2, 3. Then, insert, 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 insert. May nakita ka ng ihi. Then, insert at least 2 inches more. And then, you are now going to push the water. And then you're now going to remove. Okay? So, please do the fishing. Saan kayo nga? Sa side kayo mag-takip. Okay? Then, lagay mo dyan para hindi madisgrasya si patient. Now, i-try mong hugutin. Okay, positive. Naka-anchor na yung catheter ni patient. Since naka-anchor na yung catheter ni patient, kahit hindi na ako sterile. Kasi naka-insert na ako, sure na ako. Diba? So, I can now touch other parts. I'm now going to remove this. I will remove the drape. Kita nyo ba sitan? Manan nga maksud ti catheter na. Okay? Huwag ninyo tong masyadong tinataas, ha? Okay, so like that. Above the knee or over the knee, okay, over the legs, maghanap ka ng pag-aangkuran mo. Okay, in this case, kailangan natin ng may tali. Kasi wala. Alright, so there, thank you, ma'am. Ibabata man basit, ma'am. Okay, so there. Ay, wait lang. Bakit yun? Ma'am, 1, 2, 3. Katantaray ito'y. 1, 2, 3. Okay? Unsterile na ako nito, ah. Then, there you go. Mabalinan. So, asan na yung aking circulating? Pag lalagay kayo ng tape, make sure ninyo na adangay basit nga space for your patient pima na tapno no i-move na ti legs na hanga maguyguyo dyan. Catheter na. Now, tape 1 in the catheter. Another one dito sa malapit sa Y port. And then another one dito sa urine bag. Tapno handa nga ag ginuyod. Okay? Para hindi sila maghilaan. And this one, you give this allowance para kung gaganon yung patient, hindi naman hilang-hila yung kanyang catheter. Okay? Then, after that, you're going to fix your patient. Okay? And then explain what to expect. Okay. So what to expect? Ganito. So, Mrs. Smith, now that I inserted the catheter, I can see that the urine is freely flowing. If you feel like you want to urinate, please do not hold your urine. Just relax. Breathe in, breathe out. Hold your breath for at least 3 seconds. And then let go again so that your urine will pass out. Anyway, you are already in your urinary catheter. Hindi na po kayo maiihi sa kama. If you feel anything like there's pain or discomfort after we insert, and you observe that later on, here's the call light. Please press the call light and I will come in, deal with your needs and of course with your complaints. Pakiobserbahan po natin ang sarili natin. Alright, after that, you go out, raise the side rails if it is ordered or pag nakikita niyo kailangan ng pasyente, basta binigay ang call light. Then, gather all your equipments. Kasi since naka-gloves ka, alangan namang si circulating nurse ka hindi garo siya naka-gloves. So, ikaw ang maga-aftercare. You're going to fix all test materials. And then, anong gagawin natin? Remove tayo ng gloves. Alam naman na ninyo kung paano mag-remove ng gloves, diba? Okay, and then we go out of the room, wash our hands, and of course, we do our documentation. Ay. Now, paano kung after 4 days, sinabi ni Doc, oh, babalinan na may cut. Pwede na daw tanggalin yung catheter ng patient ninyo. So, paano ninyo tatanggalin yung catheter ng patient ninyo? Okay? Pag sinabing pwede na, huwag kayong basta-bastang nagtatanggal ng catheter. You have to train the bladder. Ibig sabihin, ibalik muna ninyo yung sensation. Siyempre, in 4 days, wala yung sensation na naiihi siya. Kasi, freely flowing, hindi na napupuno yung kanyang urinary bladder. Tayo, kapag napupuno yung urinary bladder, dun tayo nakakaramdam na naiihi tayo. Sila na naka-catheter, hindi napupuno yung urinary bladder nila. Therefore, nawawala yung sensation na naiihi sila. Now, you have to train the bladder to feel that before you remove this. Kasi kung tinanggal nyo to na hindi pa na-train ng bladder at tud, yan, tumutulo yung ihi ng patient niyo. Tatawa sila, lalabas ang ihi. Okay, so wag ganun. So, anong gagawin natin? Basahin natin doon sa doctor's order kung ilang oras yung pagitan. Kasi, for example, the doctor asked me to lock. Okay? Yan. Use the takip of your urine bag. You lock that, you kink. Ang tawag dito, if you're going to fold it, that's kink. So, you kink the urinary bag tube. I-kink ninyo yan. Let's say, sabi ni Doc, i-kink ninyo ng 1 hour. And then you're going to release it for 2 hours. And then you're going to kick it again for the next 1 hour hanggang sabihin ni patient na maka-is-is bua. Okay. So kapag naiihi na siya, positive, bumalik na yung function ng bladder, magtatanggal na tayo ng catheter. Okay? So usually, ang pagtanggal ng urinary catheter, in-order yan at least 24 to 72 hours bago yung remove the catheter. So, sasabihin doon, train bladder. Okay? Close open the bladder every 3 hours, 1 hour in between, sabi niya. So, every 3 hours kang maglalak ng 1 oras for the next 24 hours. Tapos, kapag sinabi na niyang naiihi siya, sabihin kay ma'am nurse or kay doc, ma'am, naiihi daw yung pasyente ko. Okay? Then sasabihin kay doktor, sasabihin ni doc, okay, very good, pwede na. Remove the catheter. Then that's the time we remove the catheter. Okay? So there, positive na. So I will go to my patient. Ano ang mga dala-dala ko? Pwedeng meron kayong wet wipes or tissue. And then, you have your underpad kung necessary, but not all the time, no? Kasi okay lang naman. After that, okay na, hindi na siya sterile. You don't have to wear a sterile gloves. Kailangan nyo lang gumamit ng clean gloves to protect you from the secretions coming from the patient. So, again, good afternoon, Mrs. Smith. So, I am back. I am Grace. I am your caregiver, and I am tasked to remove your catheter. Now, before we proceed, may I confirm that you are my patient? Please state your name and your birth date. Smith, blah, blah, blah. Okay. Thank you for the information, ma'am. So, during the course of this process again, I will be touching your body while repositioning you and removing your catheter. Will that be okay with you, ma'am? Okay po. So, after that, please wait for a moment. I will prepare my equipment. I will come back and let us do the procedure. So, go out, wash your hands, and then gather your equipment, a tissue, your underpad, and of course, basurahan. Okay? Bodita, ni basurahan. Then, I am now going to hold this one in a tray, and I will go back to the patient. 1, 2, 3. 1, 2, 3. So, again, good morning, Mrs. Smith. I am back and I am ready to do the procedure. Are you ready? Okay, daw. So, you sanitize your hands. Wear your clean gloves. Okay, not necessarily sterile gloves kasi magpupukod ka lang naman. And then now, Mrs. Smith, I am going to move the blanket to reveal and for me to see and access your perineal area. Okay? Alright, so there. Pag hindi naman masyado or walang secretions, you may not put the underpad. Pero pag nakikita ninyo na meron or there's a tendency na maisbo or affected isbo patient you, then you may put the underpad. Okay? So there. So Mrs. Smith, can we raise your buttocks? Help me at the count of 3. 1, 2, 3. Okay. There you go. So, naka-dorsal na yan. Hindi ko na ito dorsal ta hindi nyo kaya. Next, ano ang gagawin natin? We remove the tape. Para mas madaling hugutin mamaya. Okay? So, the tape, just put it here. Now, get your extra syringe. Kalimutan kong banggitin kanina. Okay? Hindi na siya sterile, kaya pwedeng ikaw na lang ang magtanggal. And then, you're going to remove the water na pinang-angkor nyo kanina. Okay? Again, pakiramdaman pag nag-i-insert ha. Ayan. Ayaw na niya matusok. Okay? Then, aspirate. Okay? Then, fish out. Fish out. Para hindi kayo matusok. And then, hawakan ninyo. Ma'am, at the count of 3, please take a deep breath and I will pull the urinary catheter. 1, 2, 3. And then, inirroll ninyo dun sa kamay ninyo. Okay? Paglabas, ganyan na ang itsura. You're now going to put it together with the gloves. Okay? Okay. And throw it in the, anong kulay? Yellow. Trash bag. Okay? I-check na lang ninyo kasi dito sa atin, syempre manmanuti basuraan, usually, tinatanggal natin to. Okay? And then, ito yung nilalagay natin sa yellow. Although, dapat, lahat yan kasi dinaanan ng ihi, so dapat lahat yan tatanggalin ba? Due sa kakulangan ng proper waste segregation, basta, bakit yun? Dapat dito. Okay? And then, yung observe mo, for dignity's sake ng ating pasyente, then, you can wipe. So, hindi ka naman na naka-gloves, then you just, okay, discard another one as necessary. Okay? So, gawin niyo yung mga technique para hindi nyo matatouch yung patient kahit na kayo ay hindi naka-gloves. Okay? So, there you go. Thank you, ma'am, for that cooperation. At the count of 3, we will raise your buttocks. So, we will remove your underpad. 1, 2, 3. Yung iba, yung underpad din yung pinupunas nila. Kasi ang underpad, one-time use naman. Pagbukas mo, tinatapon mo din siya. So, hindi siya nauulit sa ibang pasyente. So, yun na yun yung pinagpapat-dry nila dun sa perineal area. Mas maarte ka, o di tissue, bakit hindi, di ba? Okay. So, there. Thank you, ma'am, for the cooperation. Please observe yourself. Here is the call light. Anytime that you feel uncomfortable, now that we removed your catheter, any pain or discomfort that you feel, please feel free to tell me and I will come in and assist you. Okay, thank you so much, ma'am. Then, gather your equipments, sanitize your hands, and go out. Throw all that sa tamang lalagyan. And then, you're going to document. Mag-chart ka, mag-journal ka, na ginawa mo ng tama ang that procedure was done with utmost sterile technique and patient is safe.